Half a day, Governor. How are you feeling 1 week with COVID?
Actually, I'm doing much better. The first 3 days of the symptoms was terrible, but and was pretty scary actually because I didn't know what course it would run. And fortunately, it was just some moderate symptoms. Um, just getting tired real easily, which is of course part of the whole viral infection, and also um, trying to get my energy back. But tomorrow will be my 10th day of isolation, and I'm going to be released, hopefully. So I'm going to graduate and get a certificate of achievement or something like that. Not something that I would be very proud of in terms of an achievement,
But you survived.
but I survived. And someone was telling, I was reading something about the virus, and that people people who have the virus and don't die and survive the virus will not get reinfected, or we would have an immunity for, they don't know for how long. They're thinking maybe 2-3 years. So if you don't die, you'll live, and if you don't die, you'll survive, and you'll not get reinfected, and you won't be infectious. So that's a study that's coming out of South Korea's communicable disease center.
That'd be some great news because then that tells us the vaccine is to get the virus and survive it.
Yeah, and they're looking at herd immunity. So hopefully that comes true. You know, for every scientific study, there's always a counter study. So we'll see what happens.
Yeah, I want to talk about the first few days that the island has been in PCOR 1 real quick and the expanded community testing that we've undertaken. But what's the learning experience that if you can share, Governor, and you getting infected and you getting the virus that the community can take away?
I think the learning experience, Nick, is that we have to be very persistent in protecting ourselves and protecting our people. You know, wear your mask because it'll protect me and it'll protect you. The learning experience is that we cannot be complacent. We cannot let our guards down. And I'm very upset that we have been on a good road to recovery. We really were. I was ready to just say, hey, we've contained this virus, and let's start with our normal lives back, but continue on with our preventive measures. And then this last week and a half was terrible. It was, I think, what we were seeing the last week and a half is a result of I think people infected from other states are coming in. And I think people, again, being complacent and not wearing their mask and not wearing and not social distancing. I mean, I think it's a lesson to be learned by our whole community. Can we get back to where we were before? Absolutely. I have every confidence that our people will again rally together and fight this virus together. But we can't be doing that all the time. We need to make sure that once we get to that level again, that we sustain it and maintain it by, adhering. Bars, like I said, was a real big culprit. And I think people just started getting relaxed. And with the low rates of positive of 2 to 3 a day for many weeks, and a census at the hospital of 0 almost to 2 or 3 a day. I mean, those were really good signs. But again, we got too complacent, and we got too relaxed. We got too comfortable is what happened. And we can't be. We cannot.
What's been your perception, just seeing from your vantage point of what these first few days of PCOR 1 again has been like?
I'm hoping, Nick, we just started on Sunday morning. I'm hoping that we will contain it again. I haven't been able to go out, so, but I do get intel and information, and people are adhering and they're complying. Um, Traffic isn't all that busy out there. The malls are closed. People are staying home, and people are again adhering to the wearing of the mask diligently, consistently, persistently. So that's good. I'm glad we are doing that, and I feel comfortable that in the next week and a half, maybe 2 weeks, we'll start seeing a decrease in the cases. For example, yes, today was reported only 19, right? That's a lot better than 42 or 28, but still, I feel we're starting to see a decrease. We just closed the bars a week ago Saturday, so we're not seeing the effects of that tremendously, but I think that's going to be on its way. So I'm confident because we've gone through this. We've seen it happen. We've seen the good results of it. So again, I'm confident we're gonna contain the virus.
Does it look like at this point we may be extending PCOR 1 past or into September?
I'm hoping not. I do know that I will extend public health emergency. It expires August 29th, so we're not out of the public health emergency yet. I want to see what this week brings, and I want to see what the next week brings. And if it brings good results, we'll start opening back up again. But I'll tell you, bars may be one of the last ones.
Okay.
Bars and funerals is where we are, where we felt it. That was our weak link. I am also thinking about what to do with people coming in from those hot spots, whether we should mandate them quarantine for 5 days and then do a test, regardless whether they come with a negative PCR test or not. I haven't yet decided that. That's some of the discussions that we've been talking about, because we also saw that people that were allowed to self-quarantine were not adhering. The contact tracers are telling me this when they do go to investigate these contacts.
And so I know that you had initially responded to the concerns from the business community about this PCOR 1 causing them closures after only weeks of being in business. You said it clear in your response to Gov that if we have a sick community, then our economy is going to be sick as well. Any added response that you'd like to share with those still kind of up in arms and uncertain?
It's very true that we cannot have an economy if people who stand up the economy, people like you, me, who go out there and purchase goods and services and contribute to the economy, are sick, and we can't do that, right? If we have a very morbid community, then it's not going to be a healthy economy. The other thing is that when you really look at the public health guidelines of what is essential and what is not essential, if you really look back at it, real estate is open for appointments, okay? All grocery stores, all convenience stores, all mom and pop stores, big retail stores like Costules, Kmart, Home Depot, those are all open. Telecommunications is open. Construction industry is open. The only really non-essentials that's closed are your retail, most of your retail stores. Your malls are closed. Social gathering places are closed. the churches are closed. But for the most part, if you really look at it, there is a lot of essential businesses that are open. Auto industries are open because it's essential for auto repairs and so forth. So I think there's a balance there in what is not open and what is open, and um, those are the things I would say to the business community. It's not like I've totally shut down all types of businesses. I have not. Um, and I did shut down those businesses that are much more high risk exposure of transmission. Um, and that's pretty targeted. That's a pretty targeted strategy.
All right, got just a couple more topics to highlight here. First, less than or in about 10 days, voters are getting ready to go out and cast their votes for the primary election. Any reconsideration of delaying that or being in talks with the GEC of pushing that back?
I haven't spoken to the GEC to push it back, but I hear that it has to be as planned because of the time period for getting the general election ballots ready. So I am allowing voting to take place on August 29th. And I know also that people are still going and voting by appointment, early voting. And of course, there will be strict activities and strict restrictions of wearing masks and social distancing. And plus, when you go to vote, Nick, you don't hang out. You don't hang out and socialize. You go in and you vote and then you leave. And that's, I think, well within the 15 minutes of time for transmission. So that risk there is not very high.
Okay. Finally, in the latest results, we're seeing more individuals out of the public high schools. I think it was 2 out of Southern High, 2 more out of the Guam Police Department, essential workers that are now getting infected following
Right.
you and the Lieutenant Governor. If we continue to see these numbers as they are, past the dozens or past the teens, would that be quite clear for you then, Gov, to extend PCOR 1 even further?
I would have to regroup back with our team, and maybe we do a very restricted minimal lifting of other things, but continue to make sure that those that have an increased risk of exposure, we will continue to close off. We will have to just regroup based on what the data and the science says. This virus, Nick, is it's not discriminatory. It hits everybody and anybody, and so I am concerned about the high schools, and I think it's probably a blessing that we decided, or the Department of Education superintendent decided to delay the face-to-face opening and doing it all on distance learning for the next 2 weeks. And maybe that should continue on for at least into the first quarter of the school and see what happens there. I do know that Deodea is also, I think, following suit. I know that the private schools are also adhering to it. So it is a concern. It is a very serious concern about the public schools.
All right, good. Well, good luck. And you said you were getting your follow-up test tomorrow to see if you're all clear?
They said I don't need a test. Only that because my symptoms are no longer there. I've gone through my symptoms. I do get tired easily, but that's part of the recovery. But yes, tomorrow is my graduation day from this god-awful virus isolation, and it's no fun. I think one of the things is I'm just totally bored. But I do work virtually with my
Yeah.
staff,
Yeah.
and I do hold regular meetings with my team. But yeah, it's no fun to be cooped up in a bedroom,
Right.
and I wouldn't wish it on anybody.
What about the LT? Well, he'll be following up. See, he hasn't shown any symptoms as well, so his will be in a
He,
couple days
he
after you.
has he's had some symptoms also,
Okay.
but he's doing fine. He is doing fine. He also gets tired real easily. We text each other and we say, "Okay, don't bother me. I'm gonna go take a nap." Anyway,
Okay.
yes, I
All right.
think our
Well,
island will get better. I am very optimistic. Our island will get better.
yeah, you and I and all of us too, Gov. Good luck to you and on your speedy recovery. And I hope to hear the final word that you're all clear and graduated tomorrow morning.
Okay, thanks, Nick.
Thanks,
Be
Gov.
safe out there.
I will. You too.
Okay.